Yes.
Hey, how you been, mate? How you been?
Good.
All right. Well,
All
we
right,
we
nice.
have started recording already.
Okay.
But yeah, mate. Just gonna introduce yourself or introduce you. So this is Sean, my mate. It's been ages, hasn't it?
Been a very, very long time.
It's been a very long time.
Mm.
We went
Over
through
5 years, I would say.
thick and thin through Dandy, I believe. Is that
Yeah,
right?
Dandenong Hospital, Southeast Melbourne. Yeah.
Oh, dear me, dear me. How you been? What have you been up to? Let me know.
I've been good. So I guess since we've seen each other,
Mm.
what have I done? So after
You got into
Monash,
urology,
which was
mate.
part
What do you
of
mean?
Dandenong
Yeah.
Hospital, got
Mm.
onto urology. I did that through a PhD. So stepped out of hospital for 3 years.
Wow.
Got into urology training program. Now I'm set 3, going
You already
into
said
set
3. Holy
4.
cow. Wow.
Yeah, set 3, going to set 4. So set 4 will be my exam year, and then hopefully out the other
Wow.
side soon. Yeah,
Mate,
yeah.
honestly, I had no idea whether you actually wanted to do urology. Like when did this all come about?
Yeah, I didn't know either. I always wanted to do
Mm.
surgery, a bit more hands-on, less
Mm.
smart, all that kind of stuff. But I think it just came to a point in it was PGY3. So I'd done
Mm.
my internship on the Sunshine Coast, PGY2 at Monash, PGY3, had to
Mm.
make a decision. Then kind of fell into urology. There was a really supportive group.
Mm.
Monash took me under their wing, gave me research projects. But then as I got along, I just realized that urology is good.
Mm.
It's broad. It's very broad. It's got you got a lot of oncology, obviously,
Mm.
um, but also a lot of benign disease. You can branch out to andrology and female urology.
Obviously, urology is, very competitive. It's one of the very competitive specialty in surgery.
Is it?
Isn't it? What do you mean?
I don't know. I'm not
It
sure. I
is.
don't know. What are the stats? Do you have the stats, or
I don't have the stats.
isn't all surgery competitive, or?
I thought urology is like right up there with, plastics and neurosurgery, that kind of
Ah,
thing.
right. Yeah, right.
Obviously, this podcast is for junior doctors, intern residents, and I'm sure they're very interested about learning how to get on, right? So can you let us know how you got on?
Yeah, so I would say my pathway of getting on was abnormal.
Mm.
So, like I said, PGY3, had to make a decision, decided urology supportive group. Then there
Mm.
came an opportunity uh, that a PhD spot opened up in Melbourne,
Okay.
and I had to make a decision whether I would step out of clinical work or not. I had a
Mm.
look at the criteria for set applications for urology, and I had
Mm-hmm.
fulfilled all the clinical aspects of that. So I did
Mm.
decide to step out to complete a PhD. So that was 3 years out of hospital, completing the PhD.
Oh, wow. Okay.
Um,
Hmm.
on my second year, I applied for the program because I had enough points on my CV. I got
Mm.
on, and then I deferred a year to complete the PhD. So
So
that was my pathway on.
do you think you definitely require a PhD to get onto urology?
No, not at all.
You don't?
I
Okay.
hadn't finished my PhD. PhD was my gateway to, so essentially I uh, looked at the criteria, worked out what I needed
Mm.
in terms of my CV to get an interview, and then
Mm.
worked towards that, which was, and PhD was a gateway into getting research projects, which is what I needed at the time. So that's how
So
I got on. I guess yeah.
mm, while you're doing a PhD, obviously, were you doing it full time or part time? Like, I mean, you're saying that you
Full
stepped
time.
out of
Yeah.
full time. Wow. Okay.
Full
How,
time.
how do you
Yeah. Yeah.
how did you support yourself, mate?
Yeah. I mean, financially, you have to have a bit of support. So
Mm.
I got paid through the university, which is a stipend.
Mm.
Um, I mean, not. uh, I mean, I would say it was about half of the wage I was earning
Yeah.
as a junior doctor.
Mm.
Um, And then I supported myself through working essentially locum work. I would do
Mm.
2 nights, overnights at private hospitals
Okay.
to support myself a week.
Mm.
And then I'll do private assisting on the side. So that's
Were
how I
you
supported myself.
still kinda connected with urology team then while you're doing PhD?
Oh yeah, my whole
Mm.
PhD was through a urology team, so that's how
Oh,
I
okay,
kept
sure.
in touch.
Yeah.
Yeah, and I must say I fell into the right group of people and all that stuff. So I
Mm.
think that
Mm.
really helps myself go through. Mm.
'Cause that's quite important, isn't it? You don't wanna be detached or disconnected from the actual team itself. Once you're stepping out from the clinical, you kinda have to be on their side, still having, maintain that skill level as well. I'm just wondering whether how did you, do that at the same time? It's quite difficult, sounds
Yeah,
like.
like I said,
Yeah.
it was really abnormal. So I
Mm.
was, I think, thinking back now, I was very goal oriented. So my goal
Mm.
was to get enough points on my CV to get an interview for this training program. I didn't think about my clinical skill or anything. I'd never been a urology registrar. I'd never
Uh,
done any urological procedures in my life. So
okay.
that's how it happened. And then when I got onto the training program, my first 3 to 6 months were really
Mm.
hard,
Mm.
big learning curve, blah, blah, blah.
Mm.
But I mean, get through that. That's fine. I think it doesn't take that long to pick up all the on-call stuff for urology, and then all the emergency procedures that we're expected to do. So I think that's fine. Yeah.
Wow. Amazing. Wow.
Mm.
Okay. And
Mm.
how has it been so far since set 1 to set 3? You have a primaries, didn't you? You have to sit the primaries and
Yeah, it's
all
good.
that
So,
in
I mean,
April?
urology's 5-year training program.
Mm.
We sit an entry exam and then an exit exams. The SSE, which is our first exam, we sit in step 1 or 2. I don't know, that's fine. Um, and then we sit a fellowship exam, which I'm going to sit this year, hopefully. And then hopefully that's the exam to end all exams.
Wow, amazing, man.
So it's been good. I mean, we get assigned a state. So for
Mm.
urology, you get assigned a state. So it's an Australia-wide recruitment program, but then you get
Mhm.
assigned one state for training. I got assigned New South Wales, um, and in New South Wales, I guess it differs from other states because we have to move pretty much every year. Training spread out. That's hard
Mm.
and tough on family or wife or kids if you have any and things like that. But I mean, my experience in New South Wales is great. You get a lot of operative experience, a lot of clinical experience. Busy
Mm.
on call because I
Mhm.
think there's less registrars per hospital. But I
Mm.
mean, overall, that's good for training.
Right.
Yeah.
And I've heard you recently got married as well. Congrats. Is that right?
Did you? I did get married. Yeah, yeah. I got married in December. So yeah, got
Good
married,
job, man.
got that done in training. So
Good
that's
job,
I
man.
think
Good
good
job.
sign.
Yeah. Yeah. Kids on the way soon, I'm assume? No?
June, that's for my parents to say, not you.
Mate, amazing, dude. Congrats for, achieving that. That's an amazing achievement as well. Thinking about it. Because urology isn't, I guess, talked about that much, I guess, right? It's very niche. It's a very subspecialized specialty, isn't it?
Yeah, it is. I mean, it is such a see. I guess traditionally it was joined onto general surgery.
Mm.
Um, but as cases got more frequent and involved, it became a subspecialty. Um, I didn't know anything about urology in medical school or in even intern and
Mm.
residency, but um, from my experience, urologists always, or the urology team, very nice. Only had good experiences. I hope I've only given good experiences as a urology registrar to others. And yeah, I mean, like I said before, there's
Mm.
although it's a subspecialty of general surgery, it's actually quite broad in its entirety. It's
Mm.
you have all your oncology, kidneys, bladders, prostates, penile,
Yep.
testicular oncology,
Hmm.
but then there's also a plethora of benign pathology as well, and even delving into fertility, andrology, and also female urology, which sort of mixes in with that gynecological urology as well. So, um, the other thing about urology,
Mm,
which was very appealing for me, is there's so much technology involved in our procedures. So everything from robotic assisted procedures now, which are very commonplace, to open procedures, laparoscopic. Um, there's just a breadth that you can learn and be
mm,
involved with in
mm,
urology, which is
mm.
very appealing for me. Yeah.
Yeah, that's amazing.
Mm.
So, what kind of procedure would you be exposed to as early, once you get into set one and set two? What's it like day to day kind of thing? What kind of surgeries are you
Yeah,
expected
day
to
to
learn? And
day. So, I mean, look, I think everyone in urology starts with the basics, which
mm,
is essentially endoscopy and penoscrotal work. So, um, learning how to deal with kidney stones, cystoscopies in the bladder, the ureter, the kidney.
mm,
And then dealing with any scrotal pathology, so that would be testicular torsions, hydrocele, all the benign pathology down there.
mm,
So they're the kind of things that will get you warmed up as a urology reg.
mm.
Um, and then you transition to the major surgeries or the major operations, nephrectomies, cystectomies,
Yep.
prostatectomies, and then all the niche stuff like prosthetics, andrology, and things like that come
Wow.
probably later down the line. Yeah.
Mm, mm,
So yeah. But as a early trainee, it's all about endoscopy and the scrotal
mm,
work. So
mm.
putting cameras in, having a look, making diagnoses, lasering stones, treating bladder and urothelial cancers and these type of things.
Man,
Mm.
I'm just amazed at how obviously Hash, is a friend of ours as well,
Mm.
and I always thought, Hash was gunning for ENT, as you know. He's
Yeah.
always been a guy who wanted to do ENT, but then now he's an ophthalm reg. And,
Yeah.
I don't think like you, I don't think he had any exposure prior as well. Like he just kind of
Mm.
sort of fell into it. And once you get on, and I'm just amazed at how you guys got on. And, once you get on, I feel like it's gonna be such a steep, learning curve as well, because you're not really, you guys haven't done like a PHO job of
Mm.
urology or opthal. How do you go through that, manage that, if you haven't been really exposed to that before, you know? And it's such a sub niche specialty as well. How
Yeah,
did
I
you have any
mean,
structure
I
of any
went.
sort or?
Look, I went in eyes wide open. I knew I was
Mm,
gonna struggle first 3 to 6 months with on
mm,
call, with knowing how to do procedures and things like that. I preferenced strategically to have a place where I was not the senior registrar in my set 1 year, where I had set registrars on top of me that would support me. So that's what happened. I had two
mm.
set registrars that were senior to me. They did my second on call for the first month or so. They showed me the ropes.
Amazing.
They took me through everything. They taught
Mm.
me good habits in terms of operative procedures, managing patients, but I think most importantly, organizational skills, communication, life skills as a registrar, and then you just fly from there. But I mean,
Mm.
in urology, it's not that hard. You just pick it up in a month or two, and
Are you
you're
sure?
going from there.
I don't
I'm
think that's
sure.
true, mate.
Trust me. If I can do it, anyone can do it. Trust me, Chu. You know
Mate,
me. You
no,
know
mate,
me.
mate, you're an amazing guy, mate. You're amazing. You've always been a fun to hang around with, mate. Can we just go back a little bit and then walk us through the points, like the CB points, interviews, and like what are the requirements for people who wants to really get onto urology? Obviously,
Yeah,
PhD, I think you'll get a
urology.
huge part of it. Like get like a big
Yeah.
points or not? Mm,
Yeah, I mean, PhD gets you points, takes
mm.
3 years.
Yeah, dude. Yeah.
No one, I don't know a single person who had a PhD that applied for urology.
Mm,
It's hard to do, right, as a doctor.
mm.
But the good thing about urology applications is it's extremely transparent. So you go
Okay.
onto their website, you go onto the USAN's website, you look for the application process, you look for the criteria, they have it all there. They have everything that counts, they have how many points it's worth. they have how many points the CV is worth versus the interviews
Mhm.
versus your referees. So it's all there. The only downside about it is it changes every year.
Mm.
Slightly, the goalpost moves and
Slightly.
deviates. But the basics are still there. So the foundation's all there. So you need your clinical side, you need a bit of research, you need extracurricular things, and then you need your referees. They're the things that will get
Mm.
you an interview. And then you got to beat the person next to you for an interview. So um, usually they offer say 30 interviews and 15 spots will get. So 50% from the interviews will get a spot nationwide.
Wow.
So
Mhm.
that's the way it works. And I just really concentrated on getting those points, really.
Mm.
Yeah, being in that rat race of getting points,
Oh,
and
goodness.
then trying to score an interview. Yeah.
Would you say you got the you're on the higher side of getting all those points in
I
preparation to
don't
the
know.
interview?
So we never
Mm.
get the feedback.
Yeah.
If you get on, you don't get the feedback. But
Mm.
I would say that I was on the higher side of the
Sure.
points scale because
Mhm.
I definitely was on the lower side of the interviews because I didn't have any experience clinically. So that would make me think that my CV probably stacked up, hopefully a
Uh,
bit higher than the rest during that interview time.
mm.
So yeah.
And I guess in terms of, I mean, this could be like my personal question as well, but how did you prepare for the interview? Was there any specific things that you did, or was it something that you did with your colleagues, bosses, that kind of
Yeah,
thing?
I did it with
Mm.
so I had a group. I had a good friend and research buddy at the time,
Mm.
and we did interview prep together. There are only, there are only finite things that they can ask you in an unaccredited registrar interview, right? So you just
Mm.
write them all down, practice them again and again. We did daily practice, and there's no real substitute for practice in this situation. I think
Yeah.
on the day of the interview, I remember my interview was at 3 p.m., so I didn't
Mm.
know what to do with myself in the morning.
Mm.
Um, but it's all the basic stuff. Have a good breakfast, do some exercise if you're that way inclined.
Mm.
Um, wear a normal suit, nothing fancy, and then just go and be yourself because you've done the practice. So
Was
yeah.
it a panel interview or was it an MMR?
It's is MMI like stations because that's what it
Okay.
was. So it was like
Yeah.
there's 4 stations.
Right.
For this one, I was in, so it might have changed now, but
Yeah.
4 stations,
Yeah.
20 minutes each station.
Mm.
One was a simulated patient
Mm.
or simulated patient or health practitioner, like a nurse
Yeah.
or something. Um, and then the rest were a mix of clinical slash non-clinical questions.
Wow. Okay.
Yeah,
Yeah.
yeah,
Yeah.
yeah.
Wow.
Mm.
Sounds like a hard work. Sounds like it needs more than, a few months of practicing. Sounds like you need years of practice.
Yeah, I mean, look, so my timeline was,
Mm.
so timeline is that you register your interest for applying in January or February.
Mhm.
Then you actually register or apply for application, I think in March.
Mm.
By January, I was already practicing for the interview in
Sure.
case I got a place.
Mhm.
And then I think the actual interview was, I'm just trying to think, June, July, August, something like that.
Yeah.
So
Yeah.
mid-year.
Yeah.
So
Pretty
probably
similar
six
to
months
other
of practice.
specialties.
Obviously, with everything, you build up to the actual day. So it was pretty chill study in January, February, and then you ramp up those last couple of months. So
Mm.
that's how
Mm.
I did it anyway.
Mm.
Mm.
I do remember though. I mean, like we kind of joked about whether the specialty is competitive or not, but it is very highly competitive, and I've seen people who didn't get on, multiple times, and I think some people spend like a decade, really, like 10 years trying to get on, and they just couldn't.
Mm.
Like, what kind of age do you need to have to get onto these such as competitive subspecialty programs? I
What
think
kind of
part of it
edge?
might. Mm, I was just
Yeah.
gonna say part of it would be honestly, you need to get involved with a team. You need to know people. You need to know the unit.
Yeah.
Mm,
Yeah, I think that's part of it. Look, you always need good mentors, support, people that'll support you through,
mm,
people that will give you research projects,
mhm,
get things published, things like
mm,
that. But I think more than anything, I have just seen a lot of people that are too consumed by I mean, this is biased because I went the other way and was not
mhm,
consumed by the clinical work at all.
mm,
But there are people that I've seen that get too consumed with being a really good unaccredited registrar,
okay.
and not being selfish enough, for want of a better word, in
Mm,
um, you know, f- uh, improving their CV, referee points, and things like that. And I do think there comes a point where you need to be a little bit more self-minded
mm,
and collect the points that you need to get an interview. So you just need to do that, or else you're stuck in this, you know,
never-ending loop.
um,
Mm,
cycle of being an unaccredited registrar, which is really just a service, right, to the hospital, not really
yeah.
progressing yourself. So
Mm,
I
mm.
think that's how your mindset, when you come to that point.
I guess my next question would be, obviously, getting referees is a big part of it as well. It's a fair, I would say, one third of the total mark that you get from the referees. Difficult thing about that is how do you know whether you're actually getting a good reference? You know what I mean? Like it's not really
Yeah,
never disclosed. Kind of have to feel for it. You never know. You know what I mean?
yeah.
What was your approach, just in terms of getting a good reference?
My
You know?
approach,
Mm,
yeah, I mean, look, maybe I was not the right way to approach it. I'm not sure, but
mm,
I was super direct. So I said,
okay.
"Look," I was super direct. I went to each one. I said, "Would you mind being my referee?
Mm,
For me to be competitive at all in this application, you need to
mm,
give me 100%. And if you
yeah.
don't, or if you're not willing to, please tell me,
Hmm.
because I'll probably go and find another one." And
Yeah.
that's exactly just
It's the
how I
nature of
approached
it.
it. Yeah,
You got to
that's
be
just how
selective.
that's just what I said to them directly.
Mm,
And I had most of them said, "Look, yeah, that's fine. We'll give you 100, or like, we'll give you a really good
high
mark."
marks. Yeah, high marks. Yeah.
There was one person who said to me, "Look, I can't give you that because we haven't worked enough together," and
Sure.
That was fine.
That's
I
fine.
just
At least you know.
I that was actually fantastic because
Mm,
I just said, "Look, thank you for telling me that. I'm going to
mm,
find someone else."
mm,
That was the way it happened. Yeah, but I think it's actually changed now. So
mm,
back in the day, they used to send an email out to the referees, and they used to fill out a questionnaire. I think at the moment, urology unaccredited have to list all the consultants that they've worked with over the last 3 years or something like that.
mm.
And then the college can actually call any one of them to
Randomly.
ask
Yeah.
about. Yeah.
Mm.
So I don't know if things have changed from that point of view. But it just means that you have to be nice to everyone, right?
To everyone. Yeah, that's right.
And
Yeah.
try to get along with everyone, try to get to know everyone, and
Mm.
um, yeah, just be a good person
Yeah.
in general, I think.
So
Yeah.
not to a degree where, how general surgery, in a way that they're kind of, you're getting a referee from not just a consultant, not just your
Mm,
bosses, but also people around you, colleagues,
mm.
and, allied health and things. So urology is still, you're getting reference from your bosses, but it could be random. The college could pull
Yeah,
a
so
random
I think
person.
it's
Yeah.
bosses random at the moment,
Mm.
and there's allied health as well. I'm not sure if the
Okay.
allied health you have to list everyone you've worked with in the last 3 years. That seems
Mm.
excessive, but
Mm.
definitely when I went through, there were allied health referees as well. Yeah,
Okay.
as well as the bosses, in addition to the bosses.
Right.
Mm,
Okay.
mm,
Now, just in terms of job opportunities, once you're done,
yeah.
once you have your exit exam, you're a fellow,
Mm,
do you need to be a fellow? Do you need to study further to become more sub specialized, or is that
mm.
just an option?
Look, I don't know because I haven't crossed that
Okay.
bridge yet.
Yeah. Yeah. Yeah.
Um, But I mean, look, I just want to be a good urologist and
Mm-hmm.
be
Of course.
just capable to do what's needed in an
Mm,
emergency situation. or what I'm offering to my patients. So
Mm.
essentially, I want to have adequate training so that I feel comfortable in all those situations. And if that means that I come out after set 5 and feel that, that'd be
Yeah,
great. I don't think that'll
fantastic.
happen.
Mm.
But I think most people will go over and do a fellowship somewhere.
Somewhere else,
Um,
yeah. Mm.
yeah. Um, and I think that's the normal path. Well, not normal pathway, but the pathway most people would take.
Mm.
And in terms of job opportunities, yeah, I'm not sure. I think it's different for every situation. I think timing, luck comes into it. Um, and who you know and all this stuff comes into
Exactly.
it as well. Which
Yeah.
state you're in differs as well. There's very different systems in healthcare
Mm.
in both
Mm.
Victoria, New South Wales, Queensland, and the rest. So yeah, there's just so many variables that
Yeah,
I
of
have
course.
not
Yeah.
navigated yet
Yeah,
as a
yeah.
set 3. So
You're in there thick and thin. But I guess the reason that I ask is that after all that training, that competition, gone through all that, and at the end of the day, if there's no jobs out there, that's really, it really sucks, doesn't it? And
yeah,
I'm kind of starting to see that kind of thing maybe in general surgery as well. People are doing fellowship over after another, just trying to get that boss jobs. I feel like urology is not there yet, right? There are still opportunities for boss jobs around Australia, if you're willing to move around. Is that fair to say? Or
yeah, I think so.
yeah.
I don't think urology is there yet. I see that bottleneck a little bit with general surgery, where
Mm,
maybe I'm speaking out of turn here, but there are I see fellows that have been there for a lot of years without a consultant job. But I don't think that's the case for urology. I think the good thing about urology is that although there is a lot of oncology work and people say that that might be taken up by systemic treatments and radiation, sure.
mm,
But actually, probably the majority of most people's work is benign disease. So,
mm,
um, I don't see that in urology being a huge problem yet.
mm.
And it is a good mix of clinic and surgery as well. Um, yeah, I haven't seen that or heard of that in urology thus far,
Okay.
and
All right.
hopefully
No
never.
worries.
Yeah.
Yeah.
Mm.
Do you guys do kidney transplants, or is that just another specialty, transplant surgery?
I haven't worked in a hospital that does that, but yeah,
No.
we take usually a urologist will take the donor kidney and then
Mm,
hand it over to the transplant
the
team to put it
surgeons.
into the
Yeah.
patient. Yeah,
Yeah.
yeah,
Awesome, man.
yeah.
Is there any other hobbies or anything that you do outside of just purely doing urology at the moment?
At the moment,
Yeah.
nah. Well, I
No.
mean, yes. Nah, look, I try to keep fit, try to keep healthy.
Yeah.
That's not always easy.
Yeah, yeah, yeah.
Just got married, so got to keep my wife happy at the moment. No, look, outside of work, I like playing golf. So,
Mm,
yeah, try to play golf. Golf's hard because it takes a lot of time. So that's hard. And then I'm uh, trying to pick up a bit of skiing as well. I was
mm,
never a skier as a child or anything, but went skiing with my mates last year. Really enjoyed it, and then hopefully going again this year soon. So
amazing.
try to keep injury free and go skiing. I think. Yeah,
Mate, the reason that
yeah,
I ask is, I don't know whether you've seen our previous episode. I think one of the anesthetic registrar did say,
yeah.
"Oh, mate, like, you can't you need to have personality. You need to be likable. You're not a robot, right? You're a human. Your boss is a human. You need to interact with people in order to even have a chance to get on to this kind of training. Do you reckon that's true as well? You got to be like a likable person.
Yeah, I think. Yeah, I think you have to be likable.
Mm,
Yeah, I think you have to be likable. Like,
mm,
we've all worked with people that we don't get along with, right? Um, Makes it unenjoyable going to work. It makes
mm.
things awkward. Um, you have to manage things at work. I don't want to do that. I don't want to
Mm.
do that when I go to work. So, I think you have to be likable, compatible, sacrifice a little bit if you need to, all that stuff.
Yeah, maybe.
Um,
Mm.
yeah, and then do stuff outside of work. I think that is what gets me away and keeps me fresh, so keeps me enjoying it. for sure.
Sorry. Yeah. Hey, so while we were in Dandenong, you're PGY2 then, weren't you?
Yeah.
Yeah.
Yeah, I was.
So you went to Sunshine right after. Sounds like, yeah.
No,
Right?
so I had come, so I did so I went to a uni at Bond University, and
Yeah.
then I did my internship on the Sunshine Coast in Queensland,
Mm.
and then I came and met the famous June at Dandenong Hospital,
And the rest of people. Yeah.
and the rest.
Yeah.
Yeah, that's where I met
Fun
you,
times.
and we had an extremely intense and a time that I would never forget.
Goodness
Um,
me.
and that's where I say that if I can get through that and do this, then anyone can do this. Yeah,
Yeah.
yeah.
Yeah. Yeah.
Because that
Yeah.
was hard. That was hard. That was the
Yeah, it
hardest
was
thing I've
really
ever done in my
hard.
life.
Yeah,
Yeah,
right. I think we
like
were when did we start? We started 7:30 or 7 or something. And then we
that was
always
crazy.
went home.
Like I remember, that was plastics, right? So
Yeah,
plastics.
plastics.
I still remember 12 of us in the team, 7
Mm,
regs, 5 residents slash interns, and
mhm.
all of us never worked at Monash before day one. And round started at 6:30. We'd have to get there at like 6. And we
Exactly.
have to, do you remember back in the day, there's folders and dressings. We have to go down to eat. We had to do a ward round. Each patient take the dressing down, folders, collect them all, know all the obs, the wound dressings,
Yeah. Yeah.
sorry, the wound MCNS. And then we would still get berated by the regs. Why don't you know this? Why do you know that? Far out, there's 30 patients and antibiotics. Like, shut up.
Mate, I know
Far
I
out.
have to beep this out.
Oh my
Yeah, no, it
God. It
was
was craziness.
oh, that's right. And all the
There's some
patients that we had to
intense
cancel.
characters. Intense characters. Crazy. My God.
Oh, mate, a lot
But
of
we got
bonding though.
through.
We came out of it and we all bonded.
Yeah.
You know, we are like
Yeah.
rest of it is history. You know, you're like we are friends forever.
Yeah,
You know what I mean?
history. Hash is on the other side doing ENT. There's like 3 patients. There's like looking over at the table. Oh, are you guys all right? No. He's like, all right, cool. Didn't help us at all.
Oh, we had fun times. You know what
Uh,
I mean? That was fun.
yeah.
That was
Yeah.
really fun. This
No, that's
couple
good.
that's
That's good.
been now what 5, 6 years already, isn't it?
That
Whoa.
was, I can tell you, it was 2018 actually
Oh
when I moved back
wow.
to Melbourne. So what's that? 8
Jesus.
years now, nearly.
Wow,
Crazy.
8 years down the track.
Yeah.
Holy
Yeah.
cow. Wow.
Crazy.
I mean, it seems like everyone's done well, you know. Most of
Mm,
us is in training programs and you
yeah.
know,
Are you
getting there,
have you
getting
got the others on?
what is that?
Have you got the
Others
others
done?
on here?
Not yet. Well, we've done Henry. I don't know.
Oh,
So
yeah.
yeah, yeah. Henry was like one of the first ones who volunteered, and this is way back when we were just doing just podcasts through Spotify and that kind of thing. So we didn't want putting it on
Oh,
YouTube or anything.
awesome.
Yeah, he
Yeah.
was very popular. Obviously, plastics very popular specialty, and I'm sure
Yeah.
this one will be too as well.
Wow.
But yeah, Henry. You know, obviously Henry's a friend of the pod, friend of us.
Yeah.
Very nice man, very nice man. Like
Yeah.
I still remember, you know, he was he interviewed
Amazing
for the
body.
yeah, yeah, that as well. But
Very aesthetic.
yeah, I still remember he had that plastic reg interview, and as soon as
Yeah.
he came out, and he was like, "Oh, I'll tell you guys all the questions." I'm like, "Who does
Oh,
that?"
so
Yeah,
good.
who
Yeah,
does
so good.
that? What do you mean? Why would you ever tell us the questions? Like,
Yeah.
yeah, no, he's a nice guy, isn't he? Yeah.
Nice. Oh, that's really
Yeah,
good.
yeah, yeah. So he's almost done, I believe. He's almost done with plastic training as well.
Wow.
Yeah,
Amazing.
amazing
Amazing.
guy. Cash is in the middle of it as well, being an ophthalm
Yeah.
registrar. You know.
Opthal.
Yeah, and
That's the
here we
dream.
are.
Opthal. That's the
Urology is the
dream.
dream. What do you mean, urology?
No, no,
No,
no,
yeah,
no. Opthal is
making the
the
big bucks
dream
out
for
there.
sure. Man, what an Opthal. Cataracts for days. That's what I want to do.
Sean, it's been a pleasure, mate. It's been a pleasure talking with you about urology.
Thanks, Junie.
Any last words, mate? Any, you know, pearls of wisdom that you like to share with the audience?
Nah, no pearls of wisdom. It's all the same. Everyone's heard it all before. Nah, I think, look, if you actually want to get onto probably any surgical specialty, you need to set your goal. You need
Mhm.
to know what you need to do to like and it's all pretty much out there, all black
Yep.
and white.
Yep.
And you need to know what to do, and you need to go get it. No one's
Mm,
gonna do it for you.
mm.
So
So
unfortunately,
you got to do the
um,
grind, basically. Do the
do the
grind.
grind, go
Mm,
get it. And for me, what I did, I mean, it was good timing for me as well. But what I did
mm,
was, 12 months really hard, and then that's what got me on instead of like, spending 2 or 3 years going slowly.
mm,
So
mm,
maybe that's a
mm,
good way to do it. That was my way I did it. So
mm, mm.
yeah.
But all the courses, ATLS, CRISP, acid, whatever,
Oh, so I
get all that
didn't do
done.
that. None
Oh,
of that
really?
none of that counts for urology. So I would
Oh,
actually
what?
advise against doing all of those mandatory courses because none of them count for application, and I only did them on training, and I used
Oh,
them as
wow.
holidays. So yeah, yeah. So like, I don't know, for example, I went to Egypt to do CRISP. I went to
Yeah.
where did I go for ATLS? I can't remember. Went to Canada for ATLS. Like, just
Mm.
I would use them on training as a getaway, more than trying to get onto the program. That's what I would do. But
Is that kind of
yeah,
new thing, or like I think still general surgeries and other specialties they do count, I believe.
they do count it today. Yeah, I'm pretty sure on urology they don't. So
Huh.
yeah,
That's
for
interesting.
urology specifically, I wouldn't. Yeah, because if you don't get on, or if you don't want to do it anymore, you've wasted. How much are they each? They're five
Oh,
thousand bucks
mate.
or something.
Yeah. No, like 4K.
Yeah,
I think S is like 4K.
4K,
Man. Yeah, 3K, 4K.
crazy.
It's insane.
Yeah,
Yeah. Yeah. Yeah.
yeah,
You gotta go
could
through
use
all
that
the
to
rigmaroles.
buy other
Buy a
things.
house.
Yeah.
Buy a house or something.
Buy a house with $4,000, yeah. Be a small house, yeah,
But
yeah.
then, so that begs the question: is there a specific urology thing that you need to do? Is there a specific urology course that you need to do, or like, is there any tips that need to get done? No.
Let me think. Let me
Mm,
think. I don't think so. I don't think there's a
mm.
specific urology thing. I think if you want to do urology, you need to start getting to the right people in urology,
Yep.
and then publishing in urology specific journals. That's what I would say.
Sounds like the
Uh,
research is a big thing for urology. Doesn't
Research
have
is
to be.
traditionally quite a big thing in urology,
Mm,
yeah, because I think things are quite innovative in this field. Um, so yeah, it is quite a big thing. Yeah, I
mm.
think so. When I went through, you needed 5 first author publications at least to
Oh
max out
wow. Okay.
publication points. It might be a bit less now, but
Mm.
yeah, something like that. It's always in that realm or in that vicinity. Yeah,
Tell me about your
yeah.
PhD thesis. The topic. What did you do? Just in terms of your PhD.
I did my PhD thesis was about prostate cancer. We looked at focal therapy in prostate cancer using
Mm,
um, irreversible electroporation as the um, ablation therapy. And then we looked a little bit into PSMA PET imaging, which is a novel type of imaging for prostate cancer, and
mm,
a bit into communication and things as well. So it was a bit of a mixed bag of urology, bit of prostate cancer
mm,
um,
mm.
things. That was my PhD.
I'm surprised that you didn't die during those PhD years, mate.
PhD were the best years of my life.
Do you
I could
actually
go
enjoy
to,
them? That was my
I could,
question.
yeah, it was fantastic. It was
Holy
three
cow.
years. I didn't have to write a note. I didn't have to chart any fluids. I didn't have to chart analgesia for 3 years. I had time from during the day to go grocery shopping or do whatever I wanted. It was fantastic. It was so good.
Um,
The best 3 years of my life. Yeah.
well, plus you got to write like thousands of papers, so like you got what's
Yeah,
the
I mean,
limit?
you
Like
have to write,
5,000.
I don't know how long I think it's
Oh my
60,000 words or
goodness,
something. You have to write
Jesus
that at the end,
Christ.
but that's fine. You can just going, but nothing is ever,
Yeah,
I think nothing is ever going to be as busy as our clinical job because
yeah,
that's
that's true.
busy.
That's true.
Um,
Yeah.
yeah, and so
Uh,
PhD is probably nothing compared to that. Yeah, yeah.
what was I gonna ask you? Oh my god, just yeah, with a PhD, obviously with a PhD, at the end of it, you got to defend your thesis. How was it? What was that? What's that like? So you got to be in front of
No,
panel.
for my PhD, I'm not sure
Mm,
if you have to defend, others had to defend, but you have to. There are a few checkpoints along the way. So
mm,
you have a board of examiners,
mm,
and then they check you at 6 months, 12 months, and
okay.
yearly after that until you finish.
Mm.
Essentially, you just have to give a PowerPoint of where you're at,
Yep.
and if they think you're satisfactory, like how you're progressing is satisfactory, then
Mm.
um, they'll keep passing you. And then at
Mm.
the end, you send it off to some examiners, which read through your thesis. They give you revisions, just like any publication. They'll
Yeah.
give you revisions, then you revise and you send it
Mhm.
back, and then that's it. Yeah, you pass.
Okay.
So,
Yeah, cool, cool.
yeah, yeah, it's not that bad.
And
Mm.
and like you said, you did your PhD through university and also your unit, urology unit. Is that right? Like your
Yeah.
supervisor was
My
one of the
supervisor, well, it was all through
surgeons.
the University of Melbourne. Yeah. And
Okay.
my supervisors were urologists. Yeah.
Right,
Yeah.
right. So
Mm.
people, I guess, a question for people who wants to do PhD as part of trying to get onto training program. I'm
Yeah.
assuming it's quite important to find the right supervisor. So the right supervisor being possibly a surgeon has academia or like
Mm.
had done research or involved within the university itself. Is that um,
I
right
think
thing to
so.
say?
Yeah. So you want someone with a proven track record,
Mm,
proven to get PhD students through, because you don't want to commit
yeah,
this time of your life without getting something at the end.
exactly.
Um,
Mm,
and then for me as well, my supervisor was also heavily involved in. I had a track record of also getting people on the program as well. So he knew the points and the CV points needed, helps me with that, and then also helped me financially because I private assisted him and things like that. So
mm.
um, uh, that worked out really well for me, and I think that was the ideal PhD supervisor for anyone trying to get on the program
How
for
did you
sure.
find these supervisors? That's another question.
Yeah, I mean,
Yeah.
it was really lucky for me. I literally fell into it. There was an
Mm,
opening that I heard about from another uh, unaccredited urology registrar at the time,
okay.
and then I met with coffee with them, and then the rest is history. But I think the way to do that is to go to like speak to people, speak to urology registrars in the field that are trying to get on. That usually someone would know a prominent researcher who
Mm,
takes PhD or master's students,
mm,
and then just approach them and say, "This is what I
mm,
want." Be direct, and then they can tell you whether they can offer you what you're looking for or not. I think
mm.
that's the best way. Yeah,
And I think
yeah,
also,
yeah,
if you're looking for a specific university, there's a pages where you can look through lecturers and professors' bios.
yeah.
You could potentially kind of search through that as well, can't you? If you're looking for a PhD
That's true.
supervisor.
Yeah,
Yeah, yeah,
that's
yeah,
true. Yeah, that's true. And
yeah.
I think, yeah, but then you don't get that personal interaction, like,
Mm,
and the reviews from other registrars who know
mm,
as well. So,
mm,
yeah, you can do that as well.
mm,
Google search,
mm.
I guess. Yeah.
What is a requirement to get onto PhD? Do you need a prior research or do you need honors?
No,
What was it
I
for
did
you?
nothing. Yeah,
Oh, right, okay.
I had nothing. Yeah, I literally had nothing. Had never had I published anything before? Probably not. And I mean, the group that I went into knew that, so they knew
Hmm.
that hadn't done any research at all. They were happy to take me on and show me the ropes, essentially. So
Right.
I think
Okay.
that's fine. I think
Yeah.
most people going into research haven't had a research background, so I wouldn't be daunted by that at all. Yeah.
Because this is what I
Mm.
heard. If you are doing a undergrad or bachelor's, um, and you're
Mm.
aiming to get a research or sorry, get into a PhD, you need honors.
Mm.
You need first class honors in order for you to get into PhD. But whereas us, where we've done medicine, sounds like
Mm.
that's not really the case because I think the medicine itself is maybe like an eligibility criteria that's getting ticked, and you can just go straight to PhD. Sounds like
Yeah.
like what you did, right?
Yeah, it must be the case because I got on.
Yeah, you're the
Yeah, it
prime
must be the
example.
case because I got on.
Yeah,
Yeah, exactly. Yeah, exactly. And everyone has to have a start somewhere. Like
exactly. Yeah,
not everyone can have an honors. Like what I
uh,
mean. So
mate.
yeah,
Congratulations again, being a set reg urology registrar. Future's bright for you, mate.
thanks,
But
June.
well, mate, where would you like to like after all this is done? After you set your final
Yeah.
exam, where do you want to go? Like, do you want to stay in a particular? Like, do you want to stay in New South Wales or do you want to go back?
Look,
from
I think
Melbourne?
my family and most of my friends are from Melbourne, so I
Yeah.
would love to go back to Melbourne, and so would my wife.
Yeah.
But um, it really depends on where jobs open up, whether we like
Exactly.
Sydney, whether you give me a job in
Mm.
Queensland. I don't know.
Still a bit of a
Yeah,
moving around still.
yeah.
Yeah.
I mean, everywhere. And we've been all up and down the east coast now of Australia, actually.
Mm.
So,
Mm.
and everywhere's been fine. So, keep options open. But yeah, I think ideally back to Melbourne,
Yeah.
and
Yeah.
then see what happens. Yeah, yeah.
Perfect, Sean. Mate, thanks for coming for the pod. Thanks for
Thanks,
doing
June.
this for us.
June with
Here and
3
there.
O's.
Good job, mate.